moving down the body, I feel like a lot of guys are, maybe it's the spare tire, the dad bod, or whatever you want to call it. They lose a little definition. They want some lipo, but you have a technique that is really great for men to add sort of some definition back into maybe that muscle definition they had in their 20s. Now they're a little more squishy and soft, and that's okay. So what is your solution to the midsection for men?
So for the trunk, for the upper chest and the abdomen, definitely high definition liposuction it's a great answer. High definition liposuction, it does, or it has two attributes that regular liposuction doesn't have. And we've been doing this technique for the last 5 years. You know that when we started implementing it, and we have all of our male patients, they're so satisfied with those results. And the results look so natural when they're done correctly. The two attributes, one is, yes, it gives you back, or if you've never had it, gives you some muscle definition. And we don't create out of our imagination that muscle definition. We use the natural landmarks that the patients have. And if they have a little bit of asymmetry with one muscle more prominent than the other, or like the line goes out a little bit more of your six pack, we just reflect what you have. So it's not that we are designing superhumans, or we're just reflecting what your natural anatomy is. So muscle edging, and two, a lot of retraction from the fascia. I want to talk a little bit more about that, Monique. And I know you might know, but I'm not sure. Would you say that we should go deeper in explaining to our audience what the fascia is?
Yeah, let's do it.
Remember when we were talking about the lower eyelid, and we were talking about that white layer that with age actually relaxes and allows your fat, the fat that you already had inside, to protrude, to show. That happens as well in the abdomen. So we tend to think that our muscles of our abdomen, of our abdominal wall, is what keeps us tight and what keeps all the inner structures, meaning the bowels, the liver, the stomach, the fat that we have inside, that there are muscles, the obliques, the external obliques, internal obliques, the transverses, the rectus muscles. That's what keeps us together. And no, it's not the muscles. It's the white layer. Right? Remember, when you're cutting a steak, when you go through the muscle, it's very easy to go through the muscle because it's not strong, believe it or not. But then when you get to that rindy white part, then even with the sharpest knife, you go like, and you can't, because that is where the strength resides for all the structures to be kept together. That's the thing that HD lipo also helps with. It tightens the fascia so much between the skin and the fascia after they start retracting that you can see, and you can see that, Monique, and your audience can go into the website and look at those pictures, and you're going to see that those patients that undergo HD lipo, they look like they had a tummy tuck. Because it looks that we were putting some sutures or because that shrinkage of the fascia happens in a very strong way. So it corrects the problem of having that poochie belly without making a big incision, like an abdominoplasty or a tummy tuck.
And what would be where are your incisions for this?
They're very, very discreet. So even though, we with HD lipo, what we address is we address the chest, if the patient's interested. If not, then we're just going to go after abdomen, flanks, meaning the sides, and the lower back. And we like to always address that in a 360 way, because what you want is that 360 tightening of those muscles, instead of just just doing it at the front. Even if they come in looking for HD, but just make my front better. No, because we really
weird, right? Because it would be like, then you're soft right adjacent. So you want to have that same natural tightening.
Right. Natural tightening, and you want that belt of tightening, so you really get, quote unquote, if you kind of think about it that way, squeezed and like all the way around your waist. Our incisions go, even if we're just only addressing the abdomen, but we hide them, remember? So we are going to hide them in the areola. in the areola, even if we're going to be doing the abdomen, so in the areola, and then we go and we do it inside the belly button, not above the belly button, like when patients get like a laparoscopic procedure, right? That they do it at the margin at the belly button. No, we go inside, so nobody can see.
Oh, that is tricky.
And then the day of surgery, we ask our patients to wear their underwear or their bathing suit or whatever they normally wearing. So then we mark that. And then the other 2 incisions that go in the lower back and the other 2 incisions that go in the lower abdomen, we can hide them below the level of the bikini and female patients or their underwear or boxers that they wear, and they're going to be hiding because of the size, which is literally, imagine the tip of your small fingernail. What they're going to look like when they heal is they're like 2 very small, discrete straight lines that, again, if God forbid someone asks, either they can say, mind your own business, or they can,
I had a suspicious mole.
Right. Or they can claim that they had a small laparoscopic procedure.
Those people are too nosy, but you never know.
You never know.